Welcome. I'm Dr. Douglas Wingate, Integrative Neurorehabilitation Specialist. I want to talk about one of the most common and most underserved conditions I see in clinical practice, post-traumatic stress disorder. More specifically, I want to show you how Neurogen brain balancing approaches PTSD not just as a psychological problem, but as a neurological one, and why that distinction changes everything about how we can approach it. Let's start with what PTSD actually is. Post-traumatic stress disorder is the after effect of an overwhelming traumatic event, a chronic complex of emotional and physical symptoms in which the person re-experiences the trauma, causing intense fear, helplessness, and persistent avoidance of anything associated with the original event. Clinically, PTSD organizes into three primary symptom clusters. The first is re-experiencing flashbacks, nightmares, intrusive memories, and the kind of emotional flooding that gets triggered seemingly out of nowhere. The second is avoidance, emotional numbing, withdrawal from relationships and activities, and a suppression of trauma-related thoughts that often leads to profound isolation. The third is hyperarousal, the inability to feel safe, an exaggerated startle response, persistent sleep disruption, irritability, and difficulty concentrating. These symptoms can meaningfully impair the person's ability to function in their daily life. For many, that impairment can last for years or even decades. Here's something important to establish early. PTSD is not a rare condition and is not exclusively a veteran's diagnosis. In the general US population, prevalence runs between 7 to 9%. That's roughly 24 million Americans. Among first responders, paramedics, firefighters, law enforcement officers, rates climb to 17 to 22%. For military personnel with combat exposure, we see 10 to 30%. And for those who have sustained a traumatic brain injury, nearly 44% meet PTSD criteria. These numbers tell us something important for anyone building a referral network or clinical practice. These numbers tell us PTSD is everywhere. It presents in your trauma survivors, your accident victims, your domestic violence cases, your frontline workers, and yes, your veterans. Any comprehensive approach to PTSD treatment has an enormous potential population to serve. And here's the piece that I think is most important for people to hear. PTSD is not just a psychological response. It's a measurable, documentable, neurological state. When we look at the brains of people with PTSD using MEG and qualitative EEG imaging, we see consistent changes across four key structures. The amygdala, the brain's threat detection center, is chronically overactivated. It's locked in alarm mode, even when no actual threat is there. The prefrontal cortex, which normally functions as the rational override, is underactivated, meaning that the brain has lost its ability to tell the amygdala to stand down. The hippocampus, the memory center, shows reduced volume and function, which means trauma memories lack their time context. The past quite literally feels like the present. And the autonomic nervous system, the body's fight or flight response, is stuck in sympathetic overdrive, with cortisol dysregulation driving the hypervigilance and sleep disruption we frequently see. This is why willpower alone doesn't fix PTSD. These are structural, functional, neurological changes, and they require a neurological intervention. Neurogen brain balancing is described as a peer-reviewed literature. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. So what does that actually mean? It means during a Neurogen session, the person doesn't need to actively participate. There are no screens to watch, there's no tasks to perform, no trauma to verbally process. The brain does all of the work. The session is guided in real time by live EEG data. The system reads the brain's current electrical activity and generates a session protocol uniquely matched to what it finds. It then delivers low-intensity pulse transcranial electrical signaling, or LIB test, a gentle microcurrent that provides the nervous system with a reference point for self-regulation. The result is neuroplasticity activation, the brain's own capacity to recognize itself, form new neural pathways, and move away from the maladaptive patterns that trauma has entrenched. And this is where the clinical picture comes together clearly. Each mechanism of PTSD brain dysregulation has a corresponding neurogen effect. The amygdala hyperactivation that we see in PTSD corresponds to neurogen's documented ability to reduce pathological slow wave activity and to calm overactivation in threat processing areas. The autonomic nervous system's sympathetic overdrive, that chronic fight or flight state, responds to neurogen's promotion of vagal nerve modulation, shifting the nervous system from sympathetic dominance towards what I like to call the rest and regulate state. The suppression of prefrontal cortex function is addressed through restoration of executive regulatory capacity over emotional responses. Neuroinflammation, a significant factor in chronic PTSD, is believed to be reduced through neurogen's influence on microglial activity, and the disrupted sleep that plagues so many PTSD patients improves as the autonomic nervous system rebalancing restores more restorative sleep cycles. This isn't a general wellness intervention. This is a targeted, neurologically grounded approach that speaks directly to the underlying mechanisms of PTSD. Now, let me give you the evidence. The headline finding in an observational study of 80 veterans who completed 4 weekly Neurogen sessions, 80% reported measurable improvements in their conditions. The most commonly resolved symptoms included PTSD, anxiety, depression, sleep disturbances, chronic pain, cognitive dysfunction, and brain fog. This was published by Dr. Kassian and Dr. Turetsky in 2025 in the peer-reviewed Journal of Health. Supporting that study are several additional lines of evidence. Neuroimaging research at the University of California, San Diego showed that low-intensity pulse transcranial electrical stimulation using Neurogen significantly reduced abnormal slow wave activity in patients with mild TBI, and that those reductions strongly correlated with symptom improvement. The autonomic nervous system and vagal modulation mechanisms have also been demonstrated. This is a modality with a growing and credible evidence base, and the 80% response rate in the veteran population is a landmark finding. Something I think that's critically underappreciated in trauma care is that traditional therapies, psychotherapy, EMDR, somatic work, and even conventional active neurofeedback, all require a patient to actively engage. And for someone in the acute or subacute phases of PTSD, that active engagement can be the very thing they cannot do. Cognitive overload, dissociation, severe hyperarousal, and the avoidance of anything trauma-related are all barriers to conventional engagement-based treatments. Neurogen removes these barriers. There's no verbal processing of trauma, which means that there's no risk of re-traumatization in early phases of care. There's no cognitive demand. The patient simply rests. This makes it uniquely accessible for the most dysregulated patients, the ones conventional care is struggling to reach. It's also drug-free and designed to be adjunctive. Neurogen works well alongside things like EMDR, cognitive behavioral therapy, medication management, and somatic approaches. You don't have to choose. And its minimal side effect profile makes it a compelling alternative or complement when pharmacological options have been exhausted or are poorly tolerated. For clinicians making referral decisions, here's a practical guide. Strong candidates include anyone with a diagnosis of PTSD regardless of cause, whether it be combat, assault, accident, childhood trauma, medical trauma. Treatment-resistant cases are particularly good candidates, as are patients for whom verbal processing of trauma is not yet clinically tolerable. First responders, veterans, and frontline healthcare workers are a natural fit, as are people with comorbid traumatic brain injuries, anxiety, depression, or chronic pain. And anyone who's seeking drug-free options or wants to add a neurologically targeted tool to their existing regimen belongs in this conversation. The contraindications are narrow. Active uncontrolled seizure disorder warrants pre-treatment consultation. Implanted electrical devices like pacemakers or cochlear implants require individual review. And Neurogen is not appropriate during a severe acute psychiatric crisis or active psychosis. The integration point bears repeating. Neurogen is designed to work with the treatment approaches that you're already using, not to replace them. Trauma changes the brain, and that's a documented neurological reality. And for too long, we've asked patients to fight a neurological battle with psychological tools alone. Neurogen brain balancing offers something different: a safe, evidence informed, neurologically targeted path to nervous system regulation for PTSD patients, including those who have run out of conventional options and those looking for a powerful adjunct to the care they're already getting. For general information about this practice and our full range of integrative neurorehabilitation services, visit acuneuromodulation.com. For veterans specifically, additional resources are available at bb4vets.org. To schedule a consultation or a session, reach out directly through the website. Thank you for your time. Look forward to being a resource to you.